Hello friends, today we'll talk about the emergency treatment of stroke. Now stroke, as you know, is a major cause of death and disability. In fact, the top three causes are heart attack, cancer and stroke. And so we need to know the emergency treatments because there is something called as golden hour, or we can say golden hours, because in the first 4.5 hours there are excellent medications which are given through injections, and that can dissolve the clots in the brain. So stroke happens because of a sudden blockage of blood supply to a part of brain, and they are also called as clots or thrombus, and the treatment is aimed at dissolving those clots. So the clot dissolving medications, they are also called as thrombolytic agents. Currently there are two of them available in India. One is altiplase and second is selectivplase. So these two medications should be given in the first 4.5 hours. That does not mean that we wait till 4 hours and go to the emergency. It's not like that, because in that period also, if we are able to give the treatment early, let's say those who receive treatment in the first 60 minutes, they will have much better outcome than somebody who receives at say 4 hours. So in that period also, it is important to reach the hospital as early as possible, because every minute saved means multiple millions of neurons in the brain saved, because once the blood supply is blocked, the destruction of neurons, damage of neurons in the brain happens at a very alarming rate. So that is what we need to protect. And once somebody has crossed that 4.5 hours window period, doesn't mean that everything is lost. There are other types of treatment also. One of them is called as mechanical thrombectomy, where through the catheter a guide wire is placed, and at the site of occlusion the doctor is able to retrieve the clot and remove it, and that is called as mechanical thrombectomy. So that window period is up to little more than 4.5 hours. But there also, it doesn't mean that you will wait until the last hour is reached. So these are the two main treatments we have in the acute stroke. One is the intravenous thrombolysis, where we give injections through the vein to dissolve the clot, and then little later we have to use in the cath lab, put a guide wire and then remove the clot from the occluded vessel. And if these are done in the timely manner as per the guidelines, then the research has shown that people have lesser disability at the end of 3 months, and even the risk of death also may reduce. So commonly people feel that when we use medications like aspirin or clopidogrel, the clots can dissolve. The answer is no. They are mainly given to prevent recurrence of stroke. So if somebody has already suffered a stroke, they have a higher risk of getting second or third stroke. So by using those medications, we can prevent this next stroke. But the current clot cannot be dissolved by using aspirin or clopidogrel. So I hope this clarifies those issues. And so my message is only one: whenever a person has stroke symptoms like sudden paralysis of one side of the body, or if they cannot speak, then rush to the nearest stroke ready hospital where there is a CT scan facility and a neurologist, and then go for the best treatment and recover well. I hope you learned something from this. Have a good day.